Hi, my rejuvenating friends. I know that by today, your appetite and enthusiasm to learn more towards achieving your desired change is at an high. You are certain to produce your desired change if you continue to nurture and grow this enthusiasm. Be certain, though, to document your substantive learning from each day. On this day, too, we will share with you an understanding of how weight is managed and why you will easily control your weight by the easy steps you will be putting into practice throughout this program. A few of the things that we'll be going through in this session will be certainly understanding what is weight control, how to put a smarter plan in place, understanding what is a BMI, what is percentage body fat, understanding the benefits of slower, lifelong weight control. Towards the end, we'll take a look at some of the therapeutic options that are available to you. Weight control, simply put, is achieving and maintaining a healthy weight with effortless action or thought. For most of us, this is achieving a body mass index of between 9 and 25. We'll talk a little bit more about body mass index a little bit later. For some of us, though, achieving this BMI is not an easy road. But I want to reassure you that with even just a 10% change in your percentage body fat or a 10% change in your BMI, you will minimize your risk for chronic diseases such as diabetes, stroke, well, its complications like stroke, and cancers and other diseases. Whenever it comes to controlling your weight, it is very, very important to start with a smarter plan. Have some specific number that you're trying to attain. 10, 20 pounds. Certainly, measure it on a regular basis. But let the time span for it be realistic and certainly attainable. We advise 2 pounds of weight loss per week. Reward yourself regularly and make the journey an enjoyable conquest by having friendly rivalry with friends and teammates or even yourself. Why is it though that we put this effort behind weight control? A lot of us really just want to look good. A lot of us really just want to feel more confident about ourselves. But for us, really, what we're trying to get you to do and what I want you to remember that you're doing and also adding to when you put out the effort to lose your weight is that for those persons with a BMI or a body mass index greater than 33, you will find that your risk of getting a heart attack or even a stroke is 3 times normal person, going up to 6 times when you get to a BMI of over 40. And at that stage, your life expectancy is 20 years less than the average population. Some of the common diseases that a person with a very high BMI find themselves at risk for, or a person that's overweight find themselves at risk for, is respiratory diseases. Difficulty sleeping. You get up, you wake up, you feel like you don't sleep. This is because you're overweight. Cancers are much, much more common in persons that are overweight, whether prostate, uterine, or otherwise. The social stigma and burden that comes with being overweight often leads a lot of overweight persons to become depressed and develop psychiatric diseases, making it difficult to work or function in a routine world. A number of other things also stands out for persons with being overweight. Difficulty digesting food due to reflux or having a fatty liver. The joint pains, the swollen knees, the difficulty to move around and exercise because your joints are arthritic. Not to mention difficulty delivering or becoming pregnant in the first place. If you have to do surgery, you are at greater risk for dying, you're at greater risk for complications. All of us can recall seeing someone who is overweight with that dark skin around the back of their neck or in between their skin folds. just a few of the burdensome burdens that come with being overweight, not to mention the difficulty maintaining hygiene and the smell that can come with that. I'm glad you're on this road. But nothing beats living or not living while you're alive. And that is the true golden benefit that I want you to remember that you are going to get by controlling your weight. People who don't control their weight find that their memories don't get preserved as well. Your energy level go off faster. Your chance of suffering a compromised brain function that leads to a lack of independence comes in earlier. You will certainly be spending so much more money with me or other surgeons as time goes on versus on your vacation with your weight. Your money is your own. Protect it by just simply controlling your weight. Let's not forget the amount of pain and suffering that comes with loss of function and a shortened existence. Let's take a look at the things that are used to measure weight or percentage body or fat rather. What we're really trying to do when you go on a weight control program is really just control your weight or the fat content in your body. How much of your body is made up of fat? Body mass index is one of the things that is used to measure this. And certainly your percentage body fat, whether measured by skin folds or biometrics, is also, sorry, that's bioimpedance, is also used as a good guide. And there are many other ways to do it. Waist to hip ratio is also a good guide to the amount of fat that's on your body. But why is it that we use these things versus just simply using your weight? Well, it is found that these measures give a better guide to heart disease or cancers or even your risk of developing sudden death. So we always use them regularly. When it comes to weight control though, it is important for you to realize that losing weight too fast is also a dangerous thing. Certainly having the ability to derange your metabolic function, derail your hormonal function, and damage your kidneys. So we encourage you, 2 pounds of weight loss is the most that you should go for per week to prevent any hazardous consequences. Slower is always better. Let's look at it. Weight control is a very complex problem, and it's only in recent time that scientific research has been able to allow us to put such an excellent program together for you. Just in case you feel like going off again to that rapid quick weight loss program, remember the soggy, untoned skin that comes with it. And I know you did up your desired image profile before, and if it's the wonderful toned look you're looking for, it won't happen with rapid weight loss. Let's not forget though that fat diets also has issues with the content that all still keep you at risk for heart disease or even increase your risk for heart disease. The very same thing you are being saved from when you control your weight. I want to spend a few seconds or a few moments rather to look at some of the principles behind weight change. One of the first things to remember is that when you lose weight, this weight is not just being lost from your fat compartment, but it's also being lost from water, which is your water compartment, and your muscles as well. As your muscles grow though, you'll find that you lose more weight from your fat compartment, though you'll always lose water weight first. One of the things that help you to lose weight as well is the thermic energy of the food you eat, especially when you consume negative calorie foods such as water, and the thermic energy that is created when you exercise. Lifestyle habits can be disastrous to your weight loss program or your weight control program rather, and it's important to keep them under control. Stay away from a sedentary or a sitting lifestyle. Keep yourself active. Avoid excessive drinking. Do not eat close to your sleep time because nearly all of this food is stored as fat. When it comes to assisting with the controlling your weight, there are many levels that you can contribute meaningfully to your weight control. and not be dependent on anyone but yourself to control it. If we start from where you prepare your food, just simply making healthier choices first gets the right food on the table. By the time the food is supposed to get to your mouth, you should avoid those foods that are high in fats and get yourself healthier access to foods that have a better nutritious content with lower fat content. Once in your mouth though and head into your stomach, eating foods like potato or highly viscous liquids will always help you to feel filled quicker and reduce the chances of you consuming a high amount of fat. Beyond the stomach though, I'll tell you, there's not much that you can do, and therapeutic intervention is going to end up being the backbone. We'll talk a little bit on that later as well. You can help to increase the amount of fat you burn by increasing the thermic energy or your thermic energy that is generated by your body. Most times it's generated by the exercise that you do and building your fitness level, and certainly by the ingestion of meals and water. Your metabolic energy is always raised by your fitness level and doing regular routine exercises. And maintain a good hormone balance through good mental health is of vital importance to you. How long will it take? Yeah, you understand it now, how it's lost and how you're going to impact it, but how long it going to take? Very easy. You're going to be losing 2 pounds per week, right? So if it's 10 pounds, it's going to be 5 weeks. If it's 20 pounds, it's going to be 10 weeks. Dead simple, easy for you to remember. And don't forget, slow, safe weight gain. Many more rewards await you along the way as you meet your goals. Within the journey to safe weight control, there are some things that we found to be of great value. Achieving good control over your calorie intake, achieving good control over the portions within the diet you eat, improving on your fitness level. Having a good social support system is one of the biggest predictors of long-term weight control. Certainly, it's found if you develop your leadership skills that you will always maintain better control than those who don't. Yes, certainly supplements and some dietary enhancements will always help you to control your weight easier. And having good professional support where your chronic diseases or any other part of your wellness state is maintained in a good condition will be of great value to your long-term chances of maintaining this control. When we first met in your first session, for those of you who have come to our first session already, we would have gone through and given you a prescription that showed you that you should be eating 500 calories less. But why is this so? How does this help you? The reality is that if you take in 500 calories less than your body needs for the day to keep it going, then by the end of the week, you'd have kept a deficit of 3,500 calories, which is equivalent to about a pound. So you should be losing about a pound per week just by simply doing that. Not all of us, though, will lose this pound, and this is because of varied factors that will cause us to lose less. And sometimes we may have to consider adding supplements if we think your rate of change will be so slow. Some of the persons who we know are at innate risk for slow or slower, much slower rather, weight changes or weight control are certainly those with a family history of being overweight. Your mother, your father, your siblings are overweight. Then certainly you know that you're genetically predisposed to being overweight, and generally your rate of weight change will be slower. If your muscle bulk is smaller, then certainly you will lose weight a little bit slower. If you're on certain medications such as contraceptive steroids, these certainly also slow your rate of weight loss. If your hormonal state is not in balance, such as when you have diabetes, Cushing's, or polycystic ovaries, then you will find also that you too will be slower. If you currently eat close to your sleeping time, whether in the day or night, this will promote your body to be in a storage state versus being in a burn state. If you constantly eat a high proportion of fat and soluble sugars, then you too will be at a slower weight gain pace, or weight loss pace rather. This brings us back to where we left off when you came to your first consult. You can easily now appreciate why your initial prescription had what it had on it. Drinking water with each meal has been shown to cause a 10% greater loss of weight in persons who do it consistently. Not eating within 3 hours of your sleeping time promotes weight loss by preventing storage. Having at least half your plate as vegetables reduces the fat content in your plate and certainly enhances your chances of reducing your weight. By reducing or avoiding completely having fatty, fried, or other related foods, then you will find that your chances of weight control is greater. Exercising 30 minutes per day increases both your thermic and metabolic energies and will increase your rate of fat burn. Where you have adequate sleep and good relaxation, then you find that your mental health is maintained in a good state and you're better chance of having a better hormonal balance. There are many other things that we'll go through throughout the program and we'll discuss them with you as time goes on. But before we close, a quick glance at therapeutic options. And I put it here not as a teaser to you to go and try, but to understand that these things act at varied stages of the process. And because of the potential of side effects with each and every one, it is best to be left until you definitely do need them to support your weight change. Don't forget, let's not forget, with slower weight loss comes greater opportunities to reward yourself and those efforts of your friends. Share a simple recognition, praise, a wonderful gift done by yourself, or a wonderful reward that you had purchased. Enjoy the journey. You have a wonderful life ahead of you that is free or at reduced risk for most complications that weight carries with it.